name is Ana Luna. I'm the technical coordinator of the LAC platform, and I would like to warmly welcome you to this webinar on the experiences on monitoring led by LAC community based on a case study that we did last year. So we can document all the experiences on how the CLM is being guided in the Andean region. So we have the experience of the ITPC that for a certain period they were working um, on this CLM, and also a different experience was added to the experience of the Global Fund that for many years was taken care on in Peru. So this is also a community-led monitoring, but as it is previous to this one, it is not named like that. So also within this case study, we included the experience from the Ancla Foundation in Colombia, based on a series of several activities that were done last year. So we do believe that the community-led monitoring for LAC, for the America Latina and the Caribbean, represents a great opportunity due to the situation that we are facing. As we know, we're starting the grant program 8, and some of those countries that are in window 1 or 2 and 2, they are starting on requesting their grants. And as you have already noticed and been informed, as of the news that we received from the Global Fund in Latin America, we need to, there's an increasing amount of countries that will enter this transition period within the GC8, and some of them will join that transition period at the GC9. So with the exception of a couple of countries, I think maybe Venezuela and others who are not included in this list, in the coming years, we should be working intensively on how to program and plan the exit of the Global Fund. So we do believe that this is a extremely important tool, so we can start paying attention on different topics that are linked to this transition. So therefore, we wanted to wait on the launching of this case study so we can reflect on this period that we are starting cycle 8, on its importance and the utility of what this represents through all the development of the GC8 grant period. So that's the reason why I would like to introduce you our colleague, our dear Susan Perez. She's a specialist on monitoring led by the community from the gender rights and community from the Global Fund. Sue has worked with many countries around the world with regards on the strategies on the community-led monitoring. So she has a very broad perspective on this topic, as well as on the methodology and how it has evolved. So we asked Sue also to help us on speaking about this specific situation for Latin America, and how can we go forward based on these recommendations for the following years. So without further notice, Sue, thank you so much for accepting this invitation. I will give you the floor, but she will be speaking in English. So therefore, I kindly invite you to choose the interpretation icon where the world icon is and choose the Spanish language for you to hear in Spanish. Thank you, Julia, for your support on the interpretation. So, Sue, the floor is yours.
Thank you so much, Anwar. Can you hear me? Okay. Yeah, perfect. So thank you so much for inviting me to the session. There's a lot of interest on CLM. I'm very excited to hear later on the country examples and the success that you've had in Latin America, which is a very different context than other places, other regions in the world. So what I'm going to share with you are a bit of what we can sort of consider in planning for CLM continuation or CLM sort of transition within GC8, because you have different types of countries that are going through transition. You have others that are new, and then you have others that are existing. And so this is really meant to cover sort of the range of countries at different stages of CLM. So, the first slide here, hopefully, yes. So we all know that there are strategic shifts in GC8. We've seen this in all of the different documents. We know that the health landscape, financing landscape is changing. Integration is a very big topic. Value for money is always what we're aiming for within all of our funding. We need to make sure that we are staying true to our mission by prioritizing those populations at risk. We need to look at different kinds of sustainable financing mechanisms. And then now we have some new health products. How can we use those to actually accelerate some of the work to address these pandemics? So this is just a refresher for our framing around GC8, right? So several of your countries, I understand, are going through transition and sustainability. So you may have one more cycle left, you have maybe 2 cycles, maybe 3. And so at any point in your evolution or where you sit in this transition and sustainability, we're always asking you these questions around what is working, what is not. Because with reduced funding envelope, what CLM is working, and what should we sustain? So it's just a question for everyone to reflect on, because it's going to be difficult. And so we want to make sure that we're focusing on those programs and data from CLM that actually is making an impact. To ensure that CLM is regarded as having value to decision making, we want to look for all of those opportunities to share data, right? And this could be anywhere from NSP, this could be budget discussions. We're now talking about how can CLM be included in strategic purchasing discussions, just showing that CLM is so important to make really accurate decisions about where we're putting money and where we're fulfilling need. Given where we are, we need to look at sustainability plans, which can include many different elements in terms of costs. Where are the most important sites we need to monitor access and quality of services? And where is it most applicable to integrate multiple issues for a comprehensive CLM? Because maybe we won't be able to have many different CLMs. We're going to have to really consolidate into one comprehensive CLM. We're also, as part of the sustainability, is look at different funding sources. And in different countries, you have national pots of money. You also have decentralized resource funding sources. There's also private sector, corporations, foundations, and of course, we have multilaterals. So we need to look at all of these different sources that potentially could be supporting CLM as we transition out of the global fund. In some countries, we see that government serving as a PR or government funding CLM, some places they say, no, we can't do it. But in many countries, we've seen that actually government has been very supportive of CLM and really honoring that community-led principle in terms of allowing communities to define and organize around the issues that they want CLM to be able to monitor. So I feel like we need to open our minds to that concept. We have examples where it's worked. And so we should continue to sort of explore this as we move towards sustainability. Integration is obviously huge within GC8. It's a big topic. And when we talk about integration, there's many different dimensions of how we define integration. So integration could be including multiple issues into one CLM program. But we do recognize that it may not be applicable to all settings. So we may still need to have differentiated services, which means differentiated CLM for specific populations and their access and quality of the services. In any integrated CLM, this may also be very challenging when you're looking at site selection, or if you're looking at all the sites and you're wanting to narrow down on what are those sites that you want to monitor or you want to change, because high burden for HIV is very different than high burden for TB and high burden for malaria. So how do you come up with this group of sites when you have an integrated CLM program that covers multiple diseases? So this is something that I wanted to note for everyone. And then, of course, if you have integrated CLM, it could be really difficult to have a data collection tool that is very simple because you want to fit in all of these issues. And then the other complication or the challenge is then if you have a multi-disease data collection tool, who are the data collectors? Which affected community actually should be collecting the data, and how are they equipped to actually ask questions about diseases and issues that they are not really from that affected community? So these are some questions for us to think about. When we focus on integration of CLM data, we want to make sure that we are focusing that on the health facility quality assurance and quality improvement process. We want to get to a point where those facilities are thinking to themselves, we have to have the CLM data in order for us to be performing well and to serving our clients and our users effectively. So we want to get to this point where it's not just about we're pushing the data to them, they are trying to seek it from us, right? So we want to sort of move towards that in our GC8 process. And all of the other issues that facilities can't solve, we need to then have mechanisms and processes to elevate, right, to different levels of the health administrative level. This one point about PEPFAR, we know that PEPFAR funding has reduced, but you do have existing skill and capacity. Is there an opportunity to bring in that skill and capacity into our global fund supported programs because they are already familiar, they have lessons there. And so it's just a point to make about there's these donors that have pulled out and what is remaining could actually be very beneficial for us. Other topics and issues that have been raised in different discussions is, can you integrate the CLM role with peers, right? So we have peer navigators, we have peer support, we have peer educators, we have a whole cadre of peers supporting our folks that need to be brought into care or suspect, like in terms of TB. Are they a TB suspect? Sounds really bad, but do they have those, have they been sort of assessed to maybe be infectious with TB, let's say. But we want to make sure that if that happens, we are not taking away from their core peer tasks. It may also not be appropriate for an integrated program. And then obviously, if they are taking on a multi-disease role of CLM, They're going to need to have training on TB and malaria or HIV or human rights, because that's what the data collection tool is including. They're going to need some compensation, again, which is a challenge with reduced budgets. But, if they're going to be added tasks, it's not just for free, it's extra time, capacity, skills. And we want to make sure it's not a conflict of interest, especially if they are delivering services. Another issue that's come up is, can the CLM role be integrated into community health workers? And in a lot of countries, those are actually government supported. And so there's obvious conflict of interest aspects to that integration type of role. But if it can't happen, because there is that conflict of interest, or that CHW cannot take on this task, we absolutely must make sure that we are sharing with them the results of what is happening with CLM, because they are very much integrated in those communities and can share with those, this is what happened with CLM. These are the improvements that you should expect when you go to facility, and they can be part of the feedback mechanism with your CLM results. I'm just showing this very quickly because this is a resource that was funded by the Copper CLM initiative within the Global Fund. And the only thing that I wanted to highlight was the section 3, because if we want to really understand what we mean by integration for CLM, this resource really helps really unpack and explain what we mean. And we explain that with 3 types: bringing standalone CLM programs into 1 or 2, adding additional health topics. And in GC8, we know there's climate, impact, there's PPR, there's even budget monitoring. There's many different areas that we can integrate into our CLM program. So this is sort of like how we approach integration of those into our existing. And then this last one is integration of CLM activities into that QA and QI process, right? We want to make sure that CLM is feeding into making sure our services are quality for the populations we want to serve. These next couple of slides, very quickly, this is just reminders really, and some lessons that we've received and that we've aggregated from different country examples. We want to talk about CLM as a quality improvement mechanism. In GC7, we were languaging it as an accountability mechanism. But in GC8, we want to focus on what is the outcome of CLM, not the process of CLM. We want to focus on CLM is meant to improve quality and so of services, access and quality of services. So we want to focus on the outcome when we language what CLM is. We want to build in flexibility, because in some CLM programs, things are resolved at sites. So we need to be able to have flexibility to drop sites and then add new ones as our populations change, as the services change. So we need to build that in somehow, or have conversations about how we can be a bit more open-ended about the sites that we choose. In many places, you send a list and you say, this is where we're doing CLM. And then if you want to change, what is the process? And that may be very difficult. So we need to build that in. Prioritization, we went through that in 2025. It's still continuing in GC8. And with reduced funding, we know it's going to be even more. So focusing on where are those known problem sites? Where are those? Because by trying to have and continue a large site selection for CLM and trying to manage all this data, maybe that's not going to be the most effective for us. And so we really need to make sure that we are focusing and prioritizing. The last couple is, there could be turnover in countries, and that's happened, and we've seen that in countries. So there needs to be continuous capacity building, not only with turnover, but if you change your data collection tools or you change your data collection app, what is it? The last one is about targeted feedback. In some countries, we've seen that there's blanket data sharing. And so we need to make sure that we are being efficient with our time and targeting the data to those who have the authority to act and not do blanket data sharing. Coordination, this is sort of similar to the last bullet. Data sharing for action for those with the authority to act versus data sharing for proving the value of CLM, which is like, these are the results, this is the improvements we've been able to achieve, this is how great CLM is, which is very different than the conversations and meetings you will have with those that actually are, you're trying to get them to say, we can do these changes. Aligning CLM indicators, let's make sure that it's usable for ministries. If it's very clear that those indicators and those issues are aligned to priorities. Digital data collection, unfortunately, this is the reality, but there's a lot of costs involved, equipment, training. Some of these data collection tools are not automatically linked to a dashboard for automatic analysis and presentation. So that's something to think about. And then, of course, HR to maintain all of these things are very important. Again, not so helpful when we have reduced budgets, but these are some of the things when you're looking at your interventions, what are the minimum criteria things you need? So this is just a compilation to help you when trying to kind of figure out what are some of the technical aspects of CLM and what you can use that's free, multiple languages. We have a number of resources that were prepared under Copper CLM. And so I've included those here. If you're a country that is working on pandemic preparedness, which in my view is very much around just health systems, because pandemic preparedness is very much around just making sure your system is tight. And then that's it for me. So hopefully I've been within time and I'm happy to answer any questions. And of course, Renee is also here, who is also very knowledgeable and expert on CLM. And so hopefully between us, we can answer any questions that you have now or even after this meeting. So thank you so much.
Thank you so much, Susan, for your presentation. Thank you for your guidance. I think that they are extremely timely. It seems to me that it is very important to highlight this relevance on the integration. Integration is a word that in the GC8 cycle we will hear everywhere. We need to start. Having a better understanding on what is the optimization of this integration within the grants to come. So, and the relevance of the transition as well as the use of these community-led monitoring and the change on the approach to to be able to move on the quality services. As for the services will be having this responsibility basically from the governments turns to be a very important need. So now let me ask if there are questions. Let me, I will kindly ask you to open your microphones if you would like to raise your hand so I can give the floor. The session is open for the Q&A. Go ahead, Osvaldo. Good morning, everybody. Greetings from Cali, Colombia. Hello, Susan. Thank you so much for your presentation. I have one concern here. So within these guidelines from the Global Fund and on the GC8, I understand the importance of the CLM, but what is as the Global Fund, what are the decisions that you might have in the case for Colombia, let's say? In this past cycle, we finished a CLM program, but it was not prioritized at the end of the cycle. So the project was closed. There was no continuation to that. So it's been 6 or 7 months where we haven't had any response on the continuation of the project. So it goes a little bit against on what you are saying on regards of the importance of the continuation. In this case, we don't have that continuation. It is stopped completely. despite that we continue with the guidelines on the Global Fund and the program in Colombia, but we weren't able to get that continuation agreement. So with regards on these policies on the Global Fund on taking these decisions, it is also important to consider to have an additional support from the Global Fund. So this CLM and this continuation on these projects can be prioritized and continued in each country. Thank you, Osvaldo. Let's see if there is any other questions and just take the opportunity to answer those. So, anyone else would like to make a comment or ask a question? No? Susan, would you like to answer or Renee? Go ahead. Thank you so much. Hi, Osvaldo. Thank you for your question. We believe that CLM should be prioritized, but in reality, it is not always the case. Sue spoke a little bit of what can we do in the future with less resources, and I think that we need to think about that. We need to be creative on what can we do if there are no resources, and if we want to keep on working, and if we can push at least maybe not a CLM, but a monitoring where the sites they have a feedback system. It is a pity that it was stopped in Colombia as well as in many other countries. So we will push to be included in the next cycle, but we also know that there are less and less resources. There are no PETFAR resources, so we need to think different so the systems can be accountable in every country. So I don't know if I answered to your question. So yes, it is a shame that it was stopped. It might not always be prioritized, but we do what we can. Thank you so much. I think that something important that you highlight here is that this relevance that the platform is giving, that be convey this message to the groups, to the I know that they all have this will, but the the CCM members need to be focused on this topic also, and they need to understand the importance of the CLM for this prioritization. Yes, exactly. That is true. That's why the approach that we wanted to give to this webinar, more than showing the results that they are important, of course, now Lirice will speak about that. Uh, she will speak about this study case, which is very important as a lesson learned. But the challenge that we are facing forward is how can we give the arguments so we can include within the priorities the CLM within the new context. The new context, it is very challenging. We are facing this financing crisis that represents a lot of pressures. The global priorities are being diversified and the health topics are losing power. So facing that panorama, this international finances is decaying and we need to adapt to those realities. So that's why we consider that it is very important to speak about being able to speak about on what are the new priorities within the CLM can be fitted. And I think that we need to lead the conversation to that, how this tool that has been evolved and has been mature can continue on this innovation process through this period, that it is a very complex one. So, Andres, before moving on, hello, hello everyone. This is just a brief notion. So we had identified that sometimes the project of the Global Fund, at least in Colombia and Antioquia, it's been fragmented and it's been a separate state because there's a lot of management for the local governments to invest on purchasing the test and purchasing condoms and education, which is really important. But those activities of the CLM, we don't see any management in that regard. So it seems that they might feel that it is a risk that local governments are involved due to the interest, due to the conflict of interest, and that has not to be the case. So we had the government. We have achieved that the local government from Antioquia give us resources, and we did it in TB. So we will do it again for HIV. But how the local governments, when the civil society make us respect ourselves due to our technical work, they give us resources and they respect our autonomy. So this is a platform that is there for 2 to 3 years, and we did the launch. And I would like you to know about it because we did it with this IA. So yes, there are resources from the local governments, and what you were saying, Anwar, the cooperation is not enough, and if we don't commit the local governments, then we will perish. So we did that management with the local government so they can sponsor the platform, and then they can guide us and they be with us on the technical aspects. So later on, we can show you that platform that we have done from the local government of Antioquia. Excellent. Thank you so much, Andres. Susan, thank you so much for your time. We are very grateful. Susan is in Hanoi on the other side of the world, so for her it's time to sleep. Thank you so much, Susan. We are very grateful for your time and your guidance. Have a good night. So let's continue now. Speaking about what we were able to document during the case study that Lidice led last year, I won't give more information because Lidice will talk about that. But Lidice was the consultant who led the process on being able to gather all this information to create this case study, and she will share more in detail. Thank you so much, Anwar, and thank you everyone for being here today in this session. As Anwar was saying, last year we were able to gather information on some of the experiences of the CLM with the approach to assess or to see the level of maturity of these experiences as for the time that they have been developing, as well as on the incidents or the achievements that they have had in each of these experiences. So we were not able to gather all the exploration of all the experiences from Latin America, all the CLM experiences. Some of the El Salvador, Guatemala, Costa Rica were left aside, but we met the four that were under execution or that they had finished one cycle of this monitoring, and that also were in the Andean region. So we were focused on four countries: Colombia, Ecuador, Peru, and Bolivia, where they implemented three different models. One specific in Colombia, the ITPC model that was implemented in Ecuador and Bolivia, and then another specific model that was implemented in Peru. So as for the implementation, the timings on these CLM experiences were varied. These varied. They don't started at the same time, or it didn't happen that they have the same period. No, that varies in all of them. But we were interested on gathering some of the aspects regarding the models or the mechanisms to collect information. Also, we focus on the mechanisms to develop this roadmap or these incidence processes for the change on the policies. And finally, to solve those problems that were identified based on these CLM models. So, for example, one of the differences that we found on these different models, in the case of Ecuador and Bolivia, that was led by ITPC LATCA, this was a cyclic model. Let's say that they have these cycles to gather the information with the predetermined uh, approaches adapted at the regional level, and they were focused on the quality, accessibility, and acceptability of the health services in HIV. In Colombia, the experience that we gathered was not the one that mentioned Osvaldo, but it was a previous activity in the Urabay area in Antioquia, led by Fundación Ancla. So they gather information based on the barriers experiences that the organization found in those activities on the access that they were setting. So they were able to identify the barriers, and then they develop a pathway to solve these problems that were identified. So it was centered on these barriers linked to those who receive a diagnosis of HIV and the health system. As for the case in Peru, they were also gathering a permanent information, and we had named it as a passive gathering. And I think that in other experiences they are also using this term because it is not the organization or it is not the experience or the leaders who are looking for this information in an active way, but they receive the information from the users. They receive the information given to them mainly on the access to medication as well as some other items for treatment and adherence. So there is an individual reaction or a collective response if there is a lack on these items, and it is centralized on the ARVs and other materials. So as for the roadmap and the incidents in within these three experiences, in all those cases, they promote specific spaces, including local and national participants. In case the answer to the solution is it is at a local level, then they do activities with the local participants, responsibles of the CPS, and in the case of Colombia, or with these land authorities in the case of Ecuador and Bolivia. So mainly the liaison was with the national actors, although there were some other liaisons with the local actors, mainly when they needed a more immediate modification or an easy solution in the health facilities. In some of the countries, these spaces have been established in a more formal way with agreement and with specific spaces. And in some others, such as Peru, for example, these spaces were created in a more spontaneous way, linking the facilities that needed to solve an issue. For example, if they depend on the solution for the social security aspects, for example, they joined the group where they shared the cases, and then these situations were solved or follow up. So as for the ITPC experiences in Ecuador and Bolivia, as this was a regional experience, some indicators were defined, general indicators were defined for all the countries. Besides Ecuador and Bolivia, there were also Costa Rica and Paraguay in a first cycle, and then they they remain. And in all those cases, they did a follow-up to these specific indicators. So the number of claims, in the case of Peru, on the lack of medication, or the number of people that are not able to have access to the services that they need. And in some of the countries, there are some other process that start after this gathering of information, that they represent a long-term process. It is difficult to identify the results in a specific period, not even for 2 years. Because as for the case of Bolivia, they needed to have certain updates to the technical guidelines, and the technical guidance for this vertical transmission. Some of these were, they started working on that, and they promote some meetings, and a first update was done, and the process was very long. So even though the cycles were moving forward, we were not able to see a result, but they are moving forward. And it is evident in those meetings that they are still having those meetings. As for the case of Peru, some spaces had been created that had needed more than 5 years as for the legal aspect. So that is important to take into consideration, mainly to tolerate the frustration that things won't change in a year, but also to consider what was mentioned in the comments, that financing is needed as well as efforts on a long-term basis, and that can be discussed later. So, what are the lessons learned that we can take for this GC8, that within this year and the next one is pushing us on what work and what should we make to keep on working for the following years in this transition context? So, from the beginning, where there is this community effort, it is faster to be able to implement a CLM because the community is there, it is active, and they are in communication, and they can also start these ML CLM processes. And also to manage these alliances at a local level. Andres was sharing with us how they were able to position the CLM, and in some other places, in some TV processes, they can also they can also get this financing for these experiences on the CLM. Of course, without having this conflict of interest. And also those who had implemented these spaces for the CLM, they know that this is a process. They need to be flexible in such a way that they respond to the needs, to the problems identified, and this happen in the different experiences. Maybe there were some other indicators that were defined from the beginning, but in the way they were also identified some other problems, and that was being solved in these spaces of political incidents. As for the management of the information, in all the cases, we were able to identify that this process of systematization at the beginning, it was a little bit more spontaneous, it was more empiric, and then later on it was professionalized, and it was more it was also in Peru, for example, it started as a very spontaneous system, and then now it is digitalized and more information is being gathered. We have seen that in some other countries. It's the case of Ecuador and, and Bolivia, how they've been adapted to the local environments. And the other thing that was mentioned also was the importance of having a continuous or an ongoing approach with the political instances. And this is something that I would like to highlight from Ecuador, because now it has changed the government, but the equipment, the staff on the HIV team in Ecuador were really convinced and with a very good relationship with the CLM teams, because they understood that that will allow the program to have a better job, to do a better job. So I think that this is a step that we should not struggle with that health system. We need to create a collaboration mechanism, understanding that the CLM is for that to have a better response, not to attack or not to point out the system. And it is also evident that the more the experience, of course, there is a more acknowledgement of different instances on this CLM, the results and the impact that they do in the health system. So how do we make it sustainable? The truth is that one part of these activities from the CLM is sustained on the volunteer work from users that are in this health system. And this was one of the topics that was highlighted in the ITPC experience in different interventions that we have seen on how to use these free platforms, on how to manage these, as they were mentioning in Colombia, with local facilities that can provide these platforms, on how to collect information at a low cost. So that's all for my presentation. Thank you for being here today. And we also have time to discuss. Thank you so much, Lidise, for your presentation. Evidently, these experiences on CLM in the region had achieved a very important mature level. Of course, there are some challenges that we need to address to be able to change this data and turn them into these incidents. So according to the plan that we have for this webinar, we just wanted to close with a couple of reflections within these processes. Before moving to the closure, I would like to make a parenthesis here, because we would like to take advantage of these spaces to give you guidance, to give you proper guidance on the GC8 cycle. Some countries are there in the action, in the activities, and some others are about to start thinking. But I think that it is very important to start speaking about the tools and the resources that we have. So we will create an alert on this webinar when we share the case study as well as the resources that Sue had shared with us for you to have them handy, for you to have all the resources to do your discussions and negotiations as well as prioritizations. So I would like to give the floor now. Before going to Marlon and Rosibel, I would like to give the floor to Karen Dunaway. You know her very well from her participation in ICW. She has worked on practical guidances on how to use another tool of this incidence based on uh, strategy, which is the stigma. So she would like to share with us some specific guidance on the use of the index in the cycle of the grants. So let's go on that, and then we will give the floor to Marlon and Rosibel. Thank you. Thank you, Anwar. Thank you, the LAC platform, for giving me some words to join the discussion here, especially because the CLM is something that is growing and is being well consolidated in the region, and there's great experts in the community. So I won't take more than 10 minutes to share briefly the tool or how the index is being put together with these activities. So we asked the platform if we can have some minutes about the CLM. Is that several colleagues, not only from Latin America, but also from other regions, had approaches to the Society of the Index on how to incorporate the index within this cycle. And sometimes using, trying to connect it with the CLM or as part of the prevalence study. And as for the International Association, we've thought about how can we connect, how that it could be connected with the CLM. So that's why I wanted to share with you this tool. So how to use the data. These are practical examples on how to use this information and how to connect it with the CLM and the IVVS. And as it has been mentioned, the monitoring allows to help how the services are working in practice and also gives us information on the access and quality of services if they are responding to the needs of the people. And this index then it is there to give information to the monitoring, and it allows us to understand why they can have access or why they stop using the services. Through this index, we can also document these experiences on stigma, discrimination, the violation of the confidentiality, and many other barriers that many times we cannot monitor them on a routine basis. So in a way, the CLM says what's going on, and the stigma index allows us to understand why. And it is also relevant that within this transition context that we're speaking about sustainability, we're speaking about integration, and these are central topics within the discussion of this new cycle of the grants. Because we're not only trying to see if these services exist or if they are available, but we want to assure and understand if they feel safe, if they feel respected, and if they are in the conditions to use these services. So that's why we're trying to connect the index with the CLM to provide this evidence on regards of the human rights barriers that limit the access on the quality and the access to services. So this is a basic tool with no more than 15 pages, and we also linked it with the GC8, and there's also the differences per tool with the CLM prevalence and how the stigma index can strengthen both interventions. So the tool, you can find the tool in 3 languages. It's in Spanish. If you need more information, you can read it. So from our side, we are accompanying some countries to connect the index as well as with a prevalence study. We have some programs in a pilot stage, not only to generate the data, but also how to use it in a more strategic way and how to use the stigma index to write down the whole process for this cycle. For example, to inform about the strategies and how how to modify the practices and how is it that they get complemented, how they are integrated. Because the monitoring gives us this ongoing information on how the services work, but also the index strengthens this general view on these barriers, and both of them allow us to give a more integral response. And just to close, another reflection on what does this mean, this whole process that we're facing in the community, the whole process on sustainability, transition, integration, and in practice, the relation between the people and the services is their access, confidentiality. So whoever gets receive the service, we are doing this. We will see that on a daily basis, or we will see the results of all this integration work, and we will see that in the services. We are also seeing that how in several countries they are making decisions or they are considering what is the best for their context. Fast analysis on the risk to understand the interventions that are at risk and also understanding the minimum packages or the services that should be maintained. They are discussing on how to keep some components on the health system or how to find some other financing resources, as Lisa mentioned, and also how to assure that we as the community participation not only depends on specific aspects, but also to keep the time and the rhythm, because as our colleague from the fund said, this is something that is being supported by the governments. And the reflection is that we should not stop the essential. If people are afraid, if they have faced discrimination situations, if they don't feel respected or they lack inputs, little by little, this link is being broken, and that ends and that has an impact if they decide to come back and to receive the treatment. So as a community, our role is important and it is key for us. We need to let them know when we're speaking on their behalf that the challenge is to produce this information, to respond these processes, and to use the information that we gather with any other tool to know exactly where we are and what do we see and what are the actions and decisions that we can take. And also be sure that all the data that is collected are the experiences and do not remain isolated or that do not remain in paper. But we need to translate and use these tools so we can do these changes and identify our priorities within this grant cycle. And also being able to know which service protect, which services are protecting, and which ones can be sustained and protected. And I think that that's where we find these areas to work on, so we can be at the level of the community that we are representing. So that's all from my side. I just wanted to share this tool and just for you to let you know that we are here. I know that many countries did it 2 or 3 years ago. So the recommendation that we do from these international organizations is to repeat it, to make it cyclic, 2 to 3 years just to monitor, to check if there are some changes or to document the experiences that change on these political incidents from the first implementation. And we understand that the whole context is changing. So from our side, also we're seeing how can we connect and how can we do this reference on the CLM, on the stigma index and the prevalence study. So thank you, Anwar, for the space given, and I'm here for any questions. So yes, there is one question in the chat box. Pablo is asking how this tool fits or can be linked with the modular frame, which is the axis of the GC8. I also ask Juan Carlos to include the link so we can have access to it. It is there in Spanish, so we're just trying also to spread it. So I don't know if you have any answer to that, to Pablo's question. Yes, yes, it is linked on where can be positioned within the framework of the GC8, and it is within the human rights as well as on the monitoring and evaluation. We also included some reasoning because the index is a solid investment, and at the end we share some examples on how can we have these programmatic outcomes using the index and connecting with both tools. So yes, it is connected with the new modular framework. Thank you so much, Karen. Thank you so much for your presentation and for helping us on enriching the resources that we need for the GC8. We love you. Happy to see you. So Juan Carlos tells me that the modular framework is there in the chat box. It is available there for you to download it. So soon we will also launch a series of documents that summarize the resources that been released by the Global Fund, either as an alert or as a newsletter. So be aware of that. We are working also on a tool to help you on these discussions with the community. So let's move on. Let's move on and let's see to the future where we can start thinking what how to deal with this problem, how to face these challenges, how can we collect these lessons learned and how to put it into practice in this challenging circumstance or situation that we are about to face. So let's start with Marlon. Welcome. Welcome, Marlon. He coordinates the group in Peru, which it's close to be 40 years, right? I'm just exaggerating, right? But it seems that there are 40 years there. So congratulations to your anniversary. This is a pioneer organization to Hibar on this CLM within the context of this webinar. You had worked at the end. This is a methodology that goes together with that. So that's why we want to listen to your reflections. The floor is yours. Thank you so much. Thank you for inviting me. Next year we will be 16 years. In reality, we are building together during these 16 years. The experience of the Hivar collective shows that the community leadership has been fundamental, so we can identify these gaps and also to give the responses to HIV and also to protect the rights of those who live with HIV. So facing this transition on the Global Fund to strengthen the CLM is strategic, not only to assure sustainability of the CLM, but also to assure the response on HIV. So Our sustainability as HIBAR is based on three main pillars. This contribution from the individuals, they become the surveillance individuals, activists, and or ally organizations that together we give the alert on what's going on or what's happening in a health center or in a region in specific. Then the second pillar is the partial designation of the professional staff from the coordinating organizations. We are 15 organizations, and so one organization is chosen as the coordinator, and this is the organization that names a person as the coordinator of the team. So that's why we've been able to sustain through all these years without having a annual budget for the collective. And then the use of these technological tools, it is also important because that save us a lot of work, and also with the IA, now they can help us a lot on verifying some information and also on the systematization of the information gathered. So this model is based on trust, but mainly on trust. The first 2 years of HIBAR had been to create this trust in the communities and the surveillance to see that what is working, what helps them, and in practice, it will contribute to solve a problem or any difficulty that they might have. And also, as a benefit, as one of the benefits is the autonomy. There is no great conflict as in some other countries. This community allows the individuals that they can generate their own complaints, and we also have this human rights approach. And I highlighted in red, we don't have any permanent finances or we don't have any institutional formal structure. We are not an NGO, but we are a collective that we are working for 15 years based on this ability to respond to HIV. So we developed this model as a sustainable model that allow us to contribute. So speaking about the risk on the transition, sorry about that image on the Global Fund billets, but on the reduction in the financing for the community's activities, that's a main concern because there's less of that, and also because the processes on the social monitoring and surveillance is being decrease. And even though it could be an important strategy, because CLM provides data to work this topic. So gathering detailed information from the first sources where services and models can be implemented with quality. Also, within the risks, we have a less capacity on the based organization. By being less funds, of course, there will be less capacity on doing these political incidents activities. And also there's a risk on the delay in the timely access to prevention and treatment. So we have done this work as a priority in the surveillance and the access to medication. So how to strengthen? How to strengthen? This is the question. For us, it is important. Financing is important, but if it's sustainable or not, if we are a collective that it is based on the individuals, people living with HIV report to us on those cases, there's a coordinator that has to work on that, of course. But it is also important to contribute and to consider those public resources. So that has to be clear for us as an autonomy. So we move forward with regards on this social contracting, and sometimes we don't speak about it. So it is important that these organizations with a strong leadership and with these high levels of visibility can be part on this social contracting to solve some of the problems that might be happening in the communities. And then this diversification on the financing sources. We need to go beyond the local. We can also go to the private sector that we haven't worked on that as a Hibar. So this is something to consider in the future. How do we diversify the source and also with the within the same communities that they can also provide to the organization? It is an important value that how we can solve the problems. So now with these electronic wallets and the QR codes that you can help with these finances, we can run a campaign for that to obtain own resources. So that's what we will do in the future, and also to have this cooperation and then strengthening. This is an organization gives information to the website, and another one for the training workshop, and some other elements that at the end contribute to a specific plan of annual activities that can be run without any problem. Then the institutionalization of this role, community role. It is important to strengthen the CLM with with the policies of the national response. I don't know if this is easy or not. It might be difficult to generate a regulation that includes the CLM as an element to improve the services for HIV, for example. It is complicated and complex, but it can be achieved to give them this formal recognition and also to guarantee these spaces and actions that go beyond to create this formal role and to strengthen it. Also, as for the technical aspect, it is crucial because technology moves forward, and we started we have a nearly semi-automated system because sometimes we receive information from WhatsApp or other systems, but within the training of the CLM on the use of evidence, it's important to see and to check which other tools we can use in order to gather the information. Improving also the technical aspects using IA, we have put together on the revision on the financing of public aspects on the purchasing of medications, in that case, for the ARVs. So it is to collect some other tools that work already in the state, in the government of Peru, but uh, put in this new system, they analyze better the information. So these are part of the activities that we have. As for the lessons learned, this is the community that detects the gaps before the system. So we are useful for that because the system can have this, but we alert. We are the ones who send the alerts because there many things might happen within the medical attention or with regards of discrimination. So in that sense we can give a faster response on the services and the access to medication. So that doesn't mean that we are fighting with the government or with the state. So the idea is to improve and to solve these problems. Then the community evidence that strengthens the incidents. So the HIBAR contribution has been the evidence on the data, and now they are not only they not only represent a number, but they also have a face, and we can say that this new guideline is not working. It should be considered like this or like that. So we've been able to legitimize this and also facilitate the dialogue. So then we can exchange these experiences, or those cases can problems can be solved. But also, as I already told you, we need this sustained investment. It is not done from nowhere. Without financing, the surveillance is weakened. So in that sense, that helps us the network that we belong to. It is not only one organization doing the surveillance. We are three to four, and each one of them give the information from their perspective. So some of them provide the information, some others knowledge, and so on. Different areas give that feedback, and that represents a good support. So as for our impact as HIVAR within these 15, 16 years, it is the prevention and vulneration on health rights. That has been crucial. We are just showing this evidence on the lack of medication, on the human rights violations. So we create those alerts and claims, and we have even gone to spaces beyond the claims where we have gone with the authorities and sending these legal claims. So, and our impact also is there in the public policies. It is better that a public policy is being designed based on the evidence on what works and what doesn't, rather than having an authority that might try to design a law that doesn't give anything. So more or less, these are the results. And what is it that we offer as a model? I think that we have achieved throughout the time being able to have this validated and replicable methodology. It is an open platform for the claims that can create this data and can be systematized. We've been able to have this technical assistance for other organizations and also in our own country for some other health sectors. Let's say the topic of cancer, they want to have one of these because surveillance can be for multi-factor and different conditions. And we also have these spaces on regional articulation. In the future, we want to work in blocks. We don't want to be an isolated entity. The idea is to create a stronger, as Colombia and Ecuador, to gather information because there are many similar cases, so we can share the experience on how they solve an issue in a close country and how can we adapt that example to our country. So this is more or less what I wanted to share with you. How is it that we are working and what are our goals in the future? So this is what Lidise was explaining. How is it that an incident's work then leads us to several years of work? So this is what we had in a short period, nearly 4 to 5 years. But how is it that we are working in the incidents field to get the approval? It could be frustrating, but we need to insist if we want to change a public policy and not fade away in the intent. The idea is to be sustainable and to create these policies that allow us to grow. So these are the organizations that are part of this collective, and we are so grateful for their experience and their work because they give a lot of information. And thank you all for this invitation. Thank you so much, Marlon Castillo, for your presentation and for highlighting the relevance of going beyond the methodology on the data collection so we can reach the point of the CLM and the incidence on how to this process more than today for those countries that will start on this transition during this GC8 grant cycle will be fundamental to guarantee that within these services continue as strong as they are within this process of the global fund. So thank you so much, Marlon. This is a great contribution from your part. So now I will give the floor to our colleague Rosibel Zúñiga from the ITPC for Latin America, an organization that we are so grateful because during our experience on promoting the CLM within the community has been of great support, and we have shared spaces as well as methodology and points of view. So it is an honor for me to receive Rosibel, and we also greet our dear friend Alma Leon. So Rosibel, the floor is yours. Good morning. So happy to be here with you today. with this topic that we have work, and maybe before using maybe a different name, but in a way the civil society and that community has done this CLM. So can you help me on moving forward the slides? Thank you. Well, just to mention that ITPC through the CLM model did a pilot program during COVID 2019, 2020, 2021 in Guatemala, which it was a pilot program of what later on was named as the CLM. So this model is being inserted in the development of the program, of the alert program, where we started in 4 countries: Paraguay, Ecuador, Bolivia, and Costa Rica. And in a second stage, it's only Ecuador and Bolivia, because Paraguay, from its own national program and its own national country program, adopt the CLM model so they can develop and implement from the strategy of the country development. So this is one of the first achievements that we are able to get in a short period on the implementation of this model and project. Something that it's important to highlight is of what the CLM has been are the good practices. And within these good practices, we have the openness to different dialogues that have been able to be sustained with the civil society as well as with other key actors. So these key actors include some cooperation agencies, non-governmental institutions such as the academy, researchers, and it also includes these human rights instances. The coordination as organizations of civil society that work on the HIV response, and also that includes organizations from the LGBTQ plus community who had been also who had been considered also within this strategy of the CLM. So the coordination also with key population and those joint strategies with the key actors within the health facilities and prevention treatment with users, and also the fact of including the civil society that are embedded where the CCM is not there. And for those who had created the observatory, the community observatory and treatment that allow to have a better communication and a more prioritization on the model. And also the meetings that were held throughout the projects with the OCT and GCC that gave a more strength and opportunity for those sessions, for those virtual sessions, and also being able to see in time the proper needs of the communities so they can have a comprehensive attention in the health sector, but also within the human rights framework free of stigma and discrimination. And also in that sense, the strengthening on the capacities and the training of the CLM model to different actors, the main and the most important civil society. So we're just losing connection with you. There's not good signal. Next slide. So within some bullets that we can mention on the scope and the impact of the CLM, it is important to highlight that there was a significant change on gathering information and turning it into evidence to transform the political incidents. So that gives a power to the civil society, the observatory on treatment with the technical group where they can do strategies and actions so they can have an impact in the transformation of the services and also being able to achieve the listening and also the power of coordinating actions that will contribute with these changes on the ongoing attention. So within all that, the strengthening of this community work is one of the, we are losing connection. It is one of the most important achievements of the CLM, not only by strengthening the capacities of the organizations and the representations of the OCT or GCC, but also at a community level, some clear routes and strategies had been established to to be able to consensus and articulate joint actions that improve the quality of life of people living with HIV. And also the training on legal aspects and human rights had defined the sustainability of the actions in the next steps to follow. And this has been key on those countries that, where the CLM has been established. And now we have a clear example in Guatemala where w- actions had been taken with regards to CLM throughout the country. As for the successful experiences, and as a summary, we have the decentralization of the health services. We have the update on the integral attention guidance, the presentation to the modification on the HIV law, the meetings on the decision-making process of the OCT, the improvement on the physical structure on these spaces, the training to the health staff, as well as the training on the CLM, these actions that promote structural changes and the OCT and GCC structures in each one of these countries. And a final achievement has been the developing of this interactive dashboard. Within the ITPC website, there's a link to receive a virtual training. So, so now I will give the floor to Alfredo. Thank you so much, Lidice, Anwar, Rosie. So briefly, I will share with you. This interactive dashboard has been fundamental on creating evidence on those sections that the CLM has done on the countries. So this is an important source of information for the communities. Maybe right now as an experience to see the potentiality and the social process that the CLM can create and how that gives us the possibility to see the communities. So as part of this technical information and also to demonstrate that this technical knowledge not only is being done at the academy level, but not only with those who are devoted to this professional analysis, but we also within the communities are trying to support all these capacities, telling them that it doesn't has to be the technician in a medical aspect that tell us exactly what's going on with our lab tests. So in that sense, these activities allow us to strengthen our communities. And on the other hand, what Rosie was saying as for the ITPC, an element was developed for the actions, and it not only included these incidents, but also the stories based on the data collection. And this is truly important. Just briefly, what I would like is to see if I can share this dashboard. Let me see if my computer lets me. So this is the dashboard. It is at the ITPC website. You should go to this open data, and then below you can see. So as I was telling you, maybe the information that we find here is the progress, but they are a reference to create new dashboards, and the idea is to potentialize our communities as they develop their CLM. We understand that every model could be different and that need to be customized according to the methodology, but also I'll go to the e-learning. Here we have some courses. There are 15 training courses developed in Spanish for the community. So from them, we can see those who are related with CLM, and I think that they are available for that community. We need to see with ITPC how can you can have access to them. So there's a lot of knowledge there. There's a lot of empowerment. The TA from ITPC is always there available, and that's for you to know. We can approach and we can speak how to handle this data. We need to recognize that this management of data has more potentiality on how we can articulate the organizations of civil society. And even though this might sound a little technical, the support that ITPC can give is focused on developing the skills, so no one feels is far away. We speak about sustainability, so we need to understand that technical support is there, and many times, many of these technologies need less costs. So now we can help you on developing your own dashboards in a very economic way with less cost, not assigning too much resources. So I think that that's important. Being able to have these tools and data, it's easier and simple. So that's the message from ITBC. So now I give the floor back to Rosie. Thank you. Thank you so much, Alfredo. Sorry, it is not audible. It cannot be translated. So I think that this is a very good example to gather information. And I think that the importance there, sorry, it is not audible. This cannot be translated. So this model of the CLM is flexible. It can be adapted to the needs of the country as well as to the civil society or the organization that would like to do any type of research, specific research, because it can be adapted to those needs of the community. It is also important to highlight that the CLM model puts the person and the civil societies in the center to find solutions and to be part of those solutions and those strategies that together and with the articulation of the decision-making processes will create a structural change as for the comprehensive attention and care for the HIV population, but also on the quality of life. So therefore, In that sense, the CLM model is a model that looks to contribute in that way for the countries, for the governments, as well as for the programs, to being able to articulate and to manage these real actions that not necessarily need a bigger budget. Some of them might need, but also needs this political will and this openness in this dialogue between the different instances. And this is also a way where it can be included in those country proposals where there is a financing from the Global Fund, but also in those strategies that the national programs where they can incorporate a summary of the CLM within these national strategic plans, such as the cases of Ecuador and Bolivia, who were able to include it in their national strategic plans. And they also detected these specific lines. And as of today, they had done certain actions. The treatment community observatory, so they empowered on the role as civil society, having the tools and the instrument of easy access and easy understanding for the communities. But also it shows in a scientific way and in a efficient way that could be considered for the programs being able to incorporate these type of actions. So we're not able to listen properly. So we will always be available to keep on giving that support to our governments to improve the quality of life of our populations. And from ITPC, we are always open to the TA needed in each of the countries. During the process, we gave the technical support to Peru and Colombia, who they are also implementing these models on CLM. So if there's any country that needs the technical support, we are available. Lidise will share also a link so you can see the dashboard within the ITPC website. And also being able for you to see the virtual training that we have on CLM. So we are available to share any information. Thank you so much, Rosibel. We really appreciate your effort for being able to be with you, with us. So we understand these technical difficulties and we really appreciate your interest in being here with us. Thank you so much. So ITPC has become a technical referent. It has created this capacity, and I think that right now it's truly important to see the ITPC work to consider the possibilities for the technical support. So the invitation is there so we can keep on working and we can contact our colleagues from ITPC so we can work on the maturity of the CLM. Any final words, Lidise, to close this webinar? So I just want to thank Anwar that the attendance of those who are here and also to remember what Alfredo, Marlon, Rossi, and Osvaldo had mentioned, the possibility to look on different free alternatives, alternatives with the IA and alternatives that allow us to continue with these CLM projects with low resources, as well as on betting with this community participation. Thank you, everyone.